what up? What up, Facebook Live? So, this is my first time doing a dual Facebook Live, so bear with me. I think I invited Adele on here. Let's see. Good thing nobody hops on these lives for like the first couple minutes anyways. Let's see. Not my viewers. Hi, Naughty Beth. Hi, Christina. What up, Kelsey? What up, Stephen Johns? If you guys are hopping on, say what up. Let me see if I can add somebody. Adele. Where are you at, Adele? Where are you at? Oh my gosh. 3, 2, 1. What up? What up? Adele. Ooh, I'm gonna add you. All right. Let me give you the intro first on Adele. So, Adele is my friend, one of my business partners from the East Coast. What up, all you guys freezing your butts off in the East Coast? She has been a physical therapist for 22 years. She's an adjunct professor at Cedar Hall University. I believe that's what it's called, in New Jersey. She's got two wives. Whoa, she's got 2 kids, and she is one wife, and she has one husband. She's a business owner, entrepreneur. She did this live video a few months ago, and I was like, oh my gosh, dude, you know your stuff, okay? She did this very simple live video talking about posture and how like our neck and stuff hurts. You see this, crazy bun? How our neck and stuff can get strained by looking down at our phones all the time. And she was like giving tips and whatnot. It made me so much more conscious of the way I use my phone. And now I try to, like she says, to use it eye level, you know, to like help with your posture and things like that. Like, it was awesome. So after I had the baby, I am like struggling really bad with my posture. Like, I sit like this, right? And like I can feel my back, my stomach, like my core muscles, everything is off. So I need some help. I'm gonna add Adele. I'm gonna bring her on here. There you are. Called her just a couple days ago, and I was like, dude, can you help me out? Like my posture's terrible. I have like this like thing going down my neck sometimes. My arm like gets a weird kind of like my muscle. What up, Adele? I'm catching everybody up on our conversation yesterday. Can you guys hear her? Let me see. Say what up.
What up, guys?
Yeah, what up? So I was talking to Adele on the phone, and I was like, oh my gosh. You started telling me too about like when you were kind of postpartum, and I like got this brilliant idea. I was like, oh my gosh, we have to do a live, because we're obviously not the only ones with these issues, right? Postpartum posture and all that. And so I was like, can you please do a Facebook Live with me? And she agreed, and I love you, and I'm so thankful for you. So I guess, where should we take this? I don't know. Like, I mean, we didn't really talk about like a fix, I guess, per se. Look at my eyebrows are out of control.
Oh my God.
Okay, let me turn you up so I can hear you. Okay. What up, guys? What up? What up, Cindy Kelly?
Oh, my cousin's Pasquale.
Who?
My cousin from Italy, Pasquale. Ciao.
Oh, ciao. Dude, that's awesome. From Italy. Okay, so I was talking about how like you were talking about the phone, your posture, like looking up, things like that. My posture is terrible. What should I do about it? Honestly, like, what do I do?
Well, I mean, the most important thing is that you need to just be conscious of it, right? So like when you catch yourself slouching, you got to self-correct. Okay. Exactly. Yes. So I talked about your head posturing. So if your head is sitting in front of your body, right, that puts a lot of strain on your neck. Exactly. Right.
Yeah.
So in order to combat that, just the self-correction, of bringing your head back on your body and really trying to align your earlobe over your shoulder is going to decrease the stress on your neck. And so a really simple exercise to do that is called a chin tuck or cervical retraction. And so, like, I'm going to turn to the side, and it's simply just pulling straight back, just like that, and just holding for a brief second, right, like making a double chin. Exactly, right. So it might feel a little uncomfortable, but that's the extreme motion, and you just have to bring your head out just a little bit to be in a more neutral position.
And then, okay, so tell me though, because you also said that like breastfeeding and things like that, because like my back muscles at the end of the day sometimes feel exhausted or feel like I can't relax them, they feel kind of tight and
right. Yeah. Right. I mean, just think about it. In the last few months of your pregnancy, you had this big belly, right, hanging forward. And so your spine is being pulled and your abs really can't work efficiently. So you have this pull in the front. Exactly. So your back muscles, your back extensors get really, really tight. So in order to kind of stretch those out, if you're familiar with any kind of yoga poses, like that cat-cow stretch, you can definitely check that out. Well,
where are my yoga peeps at?
What?
I said, where are my yoga peeps at? Anisha, what up?
So, you can get onto your hands and knees and then arch your back up really, really high and then kind of sink down and let your belly go down.
Is that what it is?
That's the cat-cow stretch, yeah.
So kind of like a cobra stretch, but you're on your knees?
It's not a cobra because you are on your hands and knees, but you are just letting everything kind of sag down in through your middle and then arching up really, really high, right? To get that, the spinal extensors to really stretch out. And then you can go down into a child's pose.
Okay.
After doing
I know
that.
child's pose, I think. Let me see if I can demo real quick. Don't mind my house because I really wasn't expecting to get on the ground because I got toys all over the place. But what up? Whoa, what up? Child's pose is like this, right?
Right.
And then is this the cow one? Like that?
Yeah,
right?
And then up. Yeah, that's it. Okay. And then arch up really high.
Grouchy. Okay, but and I have a lot of moms like that I coach on for Muscle Mama Fit, that boot camp I got. A lot of them say they have like lower back pain. And could your posture be something that contributes to that?
Absolutely. Absolutely. So I love the pictures that you posted for this event, for this live, showing the bad posture and then showing the good posture. So you really need to engage your abdominals. So just pulling your belly button into your spine and just thinking about a string pulling you from the top of your head straight up to the ceiling, right, is going to engage that cylinder around your spine. That is your core. So just thinking about doing that throughout the day is an exercise in and of itself.
Right? Like you want to be able to balance a book on your head?
That's it, right? Get that lengthening through your spine. That's exactly what you want. So just by actively engaging your core, you don't have to do sit-ups. You can just actively engage your core, and that helps to support your spine.
Dude, you are the back guru. You're right, Manny. You're the back guru, Adele.
But the other thing, too, is that, during your pregnancy, the doctors always talk about doing your Kegel exercises, right? Did you do your Kegels? Right. Okay, so doing your Kegels, too, helps to engage your core muscles. So that's really, really important after pregnancy. You see?
My back right now, I was just, listening to you.
Right.
So, nice, bring your belly button in. Would you say, kind of engage your core, squeeze it, squeeze those ab muscles? Kind of keep you upright, shoulders back, like this.
That's right. And think about pulling your shoulder blades. Listen, pull your shoulder blades down into your back pockets, right? Down. There it is. There it is.
Proper. Okay. Do I look proper?
Proper, yes.
Okay, so that picture I posted, like the lady is holding her baby like hips out, holding the. How are you supposed to hold a baby then?
With your core engaged. So that second picture, right? Pulled in, right? Lifted up, and then holding the baby from the front. So do your best, like when they're little, that's how you need to hold them. But as they get older and you can kind of sling them on your hip, try not to do that. Try not to do that, because that just shifts weight all on one side and it throws your spine way out of alignment.
So you want to hold them like this, like at the front?
Yes.
When they get bigger?
Yes. So
or not at all? I'm just kidding.
Right. Once they're walking, screw it. Let them walk.
Yeah, that's what I tell Aubrey all the time. I'm like, dude, you know how to walk. I can't hold you. Like, okay, so in the front.
Yep.
Nice and tight.
In the front. Yep. Right underneath their booty. Yep.
Okay. And what about breastfeeding? Because I know, especially when I have a newborn, like that first 6 weeks, they're so little. You're like trying to hold them up and maybe like kind of slouch, to put the boob in their mouth and stuff. Like what?
I remember. So listen, there are tools out there, right? Boppy pillows. Those things are awesome. And you want to try and sit in a chair or a rocker. Like I still have the rocker that I used when I breastfed my kids, and it had a really nice high back. And what I would do is I would take one of those cervical pillows. So like I have one right here, like this guy, right? And put that around my neck and have that supported. So that way my neck...
Steven, stop messaging me. You're distracting me. Sorry, keep going.
That's all right. So that way my neck is supported and I could just rest my head back and then have the boppy pillow around my body in the front and the baby lay on the boppy pillow while I was breastfeeding. So, that way you keep your shoulders relaxed, right? And you keep your neck relaxed. So I know that, we all want to look at our babies when we're breastfeeding and everything, but that prolonged positioning for the head and neck can definitely throw your neck out. So the more you can keep your head in a neutral position, the better. Okay. So,
so that's what this is from probably, right?
Right. Yeah. Because you're breastfeeding and you're looking at the baby, which is, it's a bonding moment.
Cute.
Absolutely. It's a bonding moment, but prolonged positioning like that over time will definitely wreak havoc there. So string up, right? Head and neck relaxed and supported. And then there's many other times that you're going to have so many bonding moments with your baby. So,
question, and I don't know if you can answer this question. I get asked this a lot as a personal trainer. What do you think about waist trainers? Does that help your posture?
What trainers?
Like a waist trainer, like the cinches almost for your waist.
Oh, after pregnancy?
Well, after pregnancy, or some women will wear like a. Here you go. Someone else messaging me. Sorry. I wear the ones after pregnancy, right? They're like the belly band that you
belly binder,
nice and tight. But some women wear waist trainers like on the regular that they button in the back and they're super tight, like a corset. Yes, thank you, Crystal. Like a corset, basically. Does that help at all?
I don't recommend those, only because you don't really then need to engage your muscles, right?
That's what I'm saying.
So you're wearing the corset, and so you're being held by that device. You're not having to use your muscles.
You're not creating a good mental habit of like actually
engaging your cores, right? Engaging the core muscles, right? I don't recommend those.
Okay, so recap real quick. Like a string, right, for your posture. Keep it up. Shoulder blades into your back pockets.
You got it. Yep.
What else did we say?
Engaging the belly button into spine, right? Yes, to engage the core.
And then the stretch, cat and cow stretch, like kind of down, dip your back, right? Head up a little bit.
right? And then going into the couch and going into angry cat and down into a prayer stretch or child's pose, right?
And then for breastfeeding moms, one of those neck pillows and those boppies to really help support your head and keep you up, and then the baby nice and propped. Gosh, that seems like so simple and genius. Why the heck do I why do I just continue to struggle?
You know what? You'll be, in much better shape if you use the tools.
No, it's true. It's true. Well, Adele, thank you. I don't know. Let me see if we have any questions. I think everybody was just hopping on, saying what up. Let's see. Janelle, Myra, Kaylee, Jessica, Mallory, Carmen, Alicia, Jennifer, Jen from Tucson. What up? Cindy, Kelly, Courtney, Caesar. He's going to give these tips to his wife later. Manny, Yvonne from Japan. Konnichiwa. Manny, Crystal, Destiny, Whitney. What up, everybody? Ashley, Israel, Sarah. What up, Caitlin, Nicole, Frank. He said he doesn't have babies, but he's got a wife. Julie, Karina, Dana. What up, Dr. McGrady? Lisa, Sarah, Ronnie, Veronica, Steven. What up, guys? What up, Adele? Thank you so much for sharing your hopping on and sharing your tips on here. We should probably do this again sometime.
I would love it. Absolutely. Whatever you want to know about from a PT physical standpoint, I am here for you.
Oh, let's see. Somebody said question. I hopped on. I just hopped on. How long after doing all those moves is it a habit? I don't know. You can't really say that, right? Like, it depends on how often you practice it, how often you do it, how mentally conscious you're going to be of it. I think habits take a long time. Bad habits are quick to develop, but really hard to break, right?
Right, exactly. Yeah.
So I say you just go ahead.
No, I was just going to say, right, the more you can be conscious of it and self-correct and assume better posture, it will just become automatic for you.
I think when you start having good posture without even thinking about it, you finally made it.
Yeah, exactly. I'm telling that to my patients all the time.
Well, thank you so much, Adele. I'll talk to you soon. Oh, real quick for all you that are still on here, Adele is in our 40-day challenge group. So we also have, I know you guys have been checking it out, some certified health coaches, a holistic therapist. We got Adele up in that group. She's a physical therapist. Anisha is a wellness coach. She is like all kinds of stuff, Anisha. Yoga instructor. So I'm probably going to have to get her on a live too to help out with some of these stretches that you were talking about. But we still have the group open, you guys. We have an event page that if you want some more info, we can send you over to, or just message me or Adele, and we'll give you guys the details. But it's launching. It's launched today. We got people starting 10-day transformations, people starting the core 3, like at different times during the, like this week, next week. Like we're flexible. Like, let's do it. We're ready. We got a great team, as you can see. Adele's freaking awesome. So let's make the new year awesome. Thank you, Adele. I love you.
Thank you, Eva. Love you too, girl.
Try and stay warm on the East Coast.
Oh, please. It's going to snow Thursday.
All right, I'll talk to you later.
All right,
bye, everybody. Peace out.